We are back with Dr. Ravi Patel, Cancer Update this morning. And Dr. Patel, this is something that a lot of people are probably doing right now. We're talking about those high-protein, low-carb diets, people eating a lot of steak, a lot of beef, you know, they're ordering their In-N-Out animal style. Is that bad for you? Is that increasing your risk for cancer?
Interestingly, there's some preliminary studies in animal models which show that actually it lowers the risk of cancer. But, you know, the thing is you can't mix up that with the fact that the kind of protein you take should have low animal fat intake. So, you know, more fish, more cottage cheese. The high animal fat, particularly red meat, has other risks and also a higher risk of cancer. So the answer is yes, it does reduce the risk, but you have to be careful about the kind of food you eat. Lots of fruits, veggies, and then protein. And
if you're going to do the protein, I said animal style, I actually meant protein style, so you do it at In-N-Out. If you do the protein, if you did something like salmon, if you're doing high protein, that'd be better for you than eating a lot of the red meat.
Absolutely, yes.
Okay, and also good for your heart at the same time. Next question has to do with your immune system. Is there a way to boost your immune system in order to fight cancer?
Well, there's no actual way you personally can do it, but there's some new medicines which have come out. One of the problems with cancer cells is they sort of are invisible to the immune system.
They're tricky.
They're tricky. And so these new medicines sort of stimulate the immune system to recognize the cancer cells or strengthens it to attack them. So there are two new drugs, actually, one for prostate cancer, another for melanoma, which uses this principle. Very exciting, actually.
Yeah, because you're not having to go and use as much, if you have to do chemotherapy, you can do a milder version of that and not have to give them a long, hard version of it, which, you know, causes all kinds of side effects. Personalized care, what does it mean when you say there are personalized care plans for cancer patients nowadays?
So we can't mix that up with the sort of concierge medicine where the oncologist is going to go home and give chemotherapy. It's not that kind of stuff. It's more like recognizing what is the nature of the cancer cell in a particular individual and then tailoring a drug according to that. So that's actually reality, because we try and look at the different kinds of tumors and then identify drugs which will work for those individuals instead of, you know, one thing fits all, you know.
You analogized it to throwing a bomb in a room and hoping that it kills as many of the bad guys as possible. But when you do that, like we were saying, the side effects with chemo, you kill a lot of the good cells as well.
Absolutely.
So now the idea is with personalized care, which particular type of cancer do you have? And maybe we can use a specialized treatment where we don't have to target everything. We can just target that one thing.
That particular cancer drug, cancer cell.
Amazing how far it's come.
Yeah, it's exciting to be in oncology, actually.
You guys are studying it right now. A lot of clinical trials over there. Dr. Patel, thanks so much for coming in this morning. As always, we'll take another quick break here, and we'll be right back.